So what is a nasal splint? So nasal splint is used to cover the nose, to protect the nose after the rhinoplasty surgery, and it is used only in surgeries in which we do the osteotomies. Osteotomy is the we do the lateral osteotomies of the nasal bone to bring the nasal bone together. So nasal bone is one of the smallest bone in our body, and it heals in just 10 days. So we need the splint only for 10 days, and at Chiroesthetic clinic we use a specialized splint which is not very cumbersome to wear. It is a very small splint, but it is very effective. So all my patients, they love to wear the splint, and it is kept for 7 to 10 days to protect your nose. Then you can wear it at the night time only for next 1 week. So what is the splintage? Like if we move the bone, we just do a osteotomy, we move the bone, so we need to hold it unless it heals.
I am one of the happy and satisfied customer of Dr. Vikas Gabri of rhinoplasty. It's been almost 2 years that I've done the procedure here in the clinic. Initially, I was so worried about the results. I keep asking Dr. Vikas about the result. Even till date, I was calling him and I was keep discussing about the results and all that. But now I think I did not say anything. I cannot speak anything. My results are purely visible on the camera.
So as I have told you about the nasal splint, so very few people, very few clients, they know about the internal splint. So what is an internal splint? So in cases if we harvest the nasal septum, so in between the two nostrils there is a wall inside that is made up of the cartilage. So every plastic surgeon harvests the part of the cartilage to use it to put it back into another places in the nose. So if we remove the septum, so septum is made of the cartilage inside, and there are two mucous membranes on both sides. So when we remove the cartilage, the mucous membrane has to be opposed together. They have to pressed against each other for proper healing. So in that case, we put an internal silicone splints and we suture it inside the nose, because the part of the cartilage is harvested, so there should not be any accumulation of the blood or the fluid. So we press the mucous membrane together. So that is the internal splint. That is, none of the clients, very few clients, they know about it, but we put it inside the nose and we remove it after say 4 to 5 days, and it is not visible. This is a temporary splint, but this is a very important internal splint. The most important question my clients ask me is, for how many days my nose will be blocked? So that is very important. I tell them it can be for 1 day or for 2 days. So we put a medical grade nasal pack, because we have to, it is a major surgery, we have to put a pack inside, so there is no bleeding or no oozing of the fluid, there is no accumulation, there is no accumulation of the tissues inside. So if we do the surgery say on Monday, we will call you back on Wednesday, that is after 1 day, to remove the nasal pack. So in first 24 to 48 hours you have to breathe from your mouth. So it is not very difficult, because normally we chew, we eat, or we talk from the mouth and we breathe from the nose. So when your nose is blocked, you have to breathe from your mouth, and your mouth will become dry. So you keep on sipping water or any lozenges or anything to eat to lubricate your oral cavity or mouth. So that is not much of a problem. So none of my patients have faced any problem, and we remove it as early as possible. So that is my policy. So we are very meticulous in our surgery. So now we can reduce the time for the nasal packing to just 1 day. Thank you.